For this occupational therapy portfolio topic, we're going to be testing my patient's coordination using 3 different movements. First, we're going to do the rapid alternating movement. Second, we're going to do the point-to-point movement using the finger-to-nose method. And then our third time, we're going to do another point-to-point movement, but we're going to use the heel-to-shin method. So the first one we're going to do is rapid alternating movement.
Okay.
So what I'm going to have you do is I'm going to have you place your palms down on your legs, and then I'm going to have you lift your hands up with your palms up, back down, back up, back down, back up, and then what I'm going to have you do is do that about as rapidly as you can for 10 seconds, and then yeah, I'm going to watch you, okay? So whenever you're ready.
You'll tell me when to stop?
Yes.
Okay.
Okay, so this is testing, again, coordination, and it requires proprioception, strength, and range of motion, and I'm looking for them to be able to coordinate their movement so that they're equal on both sides, and if it's not, then it is an indication of impairment. So the second one that we're going to do is our point-to-point with our finger-to-nose method. So I'm going to have us kind of scoot our chairs toward each other, okay? And what I'm going to have you do is I'm going to have you touch your nose with your finger, and then I'm going to have you touch my index finger. So touch your nose, touch my finger, your nose, my finger, your nose, okay? And back and forth rapidly, okay? And then what I'm going to have you do is I'm going to have you close your eyes and keep doing it. Great, okay. So this one also requires proprioception, strength, range of motion. Range of motion. Again, we're testing coordination. And again, I want to make sure that they're not overshooting my finger or missing. They should be able to do this movement both with their eyes open and their eyes closed. For our third test for coordination, this is our heel-to-shin assessment, which should be done supine if possible, but it also can be done seated. So what I'm going to have my client do is I'm going to have you take the heel of one of your feet to your knee, down to your shin, slide it up to your knee, slide it down to your ankle, and back and forth. Do that a couple times. Okay, and now we're going to go ahead and use the other heel of the other foot up to the knee, slide it down to the ankle, slide it up to the knee, slide it down to the ankle, and back and forth. Okay, you can go ahead and stop. So again, this requires proprioception, strength, and range of motion, and we're testing for coordination. I'm trying to make sure that my patient is able to touch the heel to the shin during the entirety of the slide, and that they're able to bring the heel to the knee and to the ankle, understanding where their heel is in relation to the knee, and that they're able to do it equally on both sides. If not, this would be considered abnormal coordination.